rheumatic heart disease. Well, that's rheumatic heart disease gave you a murmur sound because it caused some heart damage if you weren't treated. And that's a valvular defect.
Did polio have an impact also?
No. Well, polio is a very huge problem. Neurologically, there can be resistance changes with polio. But as far as specifically having valvular problems, that's rheumatic fever or bacterial infection. Yeah. And you can treat now with antibiotics. That's why we treat. Right. So some people need surgical correction of valves. Murmurs are indicators of disease, yes. Is that disease significant? Your doctor has to tell you that. And if it's new, nobody said you had a murmur before, ask some questions. You shouldn't get a new murmur. You should maybe have a progressing one, but shouldn't all of a sudden have a new one. That's something different. Check that out. Yes?
I exercise a lot. The main reason I started years ago was my mother died of a heart attack.
Mm-hmm. At what age?
72.
Okay.
I'm getting there. Anyway, so I exercise a lot, but it sounded like something you mentioned before. You're saying exercise is not good?
Oh, no, I didn't say that at all. If you have exercise intolerance, and that's my fault if I said that, that it's not good. It can be extraordinary. Exercise is awesome, and I'll talk about the things to help in a minute. So it's about your tolerance to exercise. If it suddenly changes, and there's no real reason why you know it's changed, it's called exercise tolerance. If that's gone down and you don't really have a reason, even if it's not as good as you think it should be, you go to your doctor and say, I'm not tolerating exercise, and then they can do some tests for you. And if you have risk factors, they might even do a cardiac stress test. They watch your heart electrically work while you do exercise, and then you can really feel safe about pushing it. They found that profound, significant, relatively strenuous exercise under appropriate supervision, even with those with heart attacks, can improve and do improve both lifestyle and length of life. Exercise is the cure for most diseases. If you had the right amount of exercise and the right type of diet, many diseases wouldn't exist. But we don't do those things. So some people do everything right and they still have a heart attack. Well, that's the hereditary part of high blood pressure or high cholesterol. So you need to know about it so we control what we can. Even the very sick, they're now doing weightlifting, and I'm not saying put somebody under a big bar. They do controlled weightlifting for the very old, and they're finding that even in the absence of certain hormones that build muscle, that we thought older guys, for example, didn't build a lot of muscle, they're finding now have awesome potential muscle growth. Skeletal muscle. You can be really, you can start and just under supervision, knowing your risk factors. Yeah.
I was diagnosed, I had a childhood heart murmur, and I was wondering, does that pose a problem as you get older?
Right. I would say this is one thing that happens to, and you might be blown off by many doctors because most all of us have a murmur when we're young, because we have a volume and growth discrepancy to the pump, so you get a little bit of a separation from when the valves close. It's a long story, so you have an extra little sound. And that little sound is physiologic. It's normal. You also get one when you're pregnant because you have blood volume changes and your pump has a different sound. You have to know, or people that are extraordinarily fit can have a different little extra sound. That is physiologic, not pathologic. So most young people have a little sound when they're young that's considered normal. So if your doctor is hyperverbal or doesn't understand what he's listening to and you hear that word and then he writes it in the chart, it could be absolutely nothing. And then it goes away in adulthood. Well, I had one when I was a kid. That usually puts us all at rest. Doctors usually find that a little more comforting. That was probably physiologic, maybe not understood, checked out to be negative. But not always. If you knew you had one as a kid, you need to make sure you have thorough workups as an adult, especially if it was not cleared as being normal. And the best test that I think determines true flow is an echocardiogram. And that's where they go in with a little wand and it shows you the velocity and flow of blood through your heart, through your valves and out and into the heart. And so it's a functional test that's extraordinarily good with that issue. So again, exercise is great, but you have to know what you tolerate and you push it and you do it. Having your mother pass in the 70s age is really not considered necessarily an absolute family risk for early death. It really is, there's a big statistical change if it's before 50. because then it's usually not just lifestyle, there's something else there that, because we really are pretty tough. We compensate really well, so you really shouldn't die before 50 unless there's some profound issue. Morbidly obese, or you have a congenital problem, or you have profound high blood pressure that wasn't treated. Something is there. So, yeah, and you can have a sudden massive and an otherwise normal looking heart. That is possible. It doesn't mean you blow it off, but it's also a little less of a ding ding to me, because she was in her 70s. You go to your doctor, get checked out, tell them your family history, and then hopefully it was her risk that you didn't inherit.